I think there's one thing that almost all of Americans have in common, and that is that we do not like to waste our own money. In fact, most of us will go to great lengths to make sure that our hard-earned dollars are never wasted. But sadly, there's millions of Americans today that are on Medicare that are throwing their money away. So in this video, I'm going to explain why this is happening and how, if you happen to be throwing your money away, this can be reversed. Now, just before we get into the details about those who are throwing money away, I want to make sure that you understand that not everyone's throwing their money away by being enrolled into Medicare. So let's clarify that for sure, because there are certain people that have to go on Medicare at 65. Okay, first off, anyone who's no longer working. In other words, you don't have an employer plan available, or your spouse does not, and so you have to go on Medicare at 65. So I want you to know you're certainly not throwing away your money because Medicare was your only option. Also, anyone that's covered by some type of a COBRA insurance, typically a previous employer is providing COBRA, and what happens at 65 is this. If someone has COBRA becomes the second payer, and so someone has to enroll into Medicare A and B at 65 because Medicare will pay first, COBRA pays second. So when someone is on COBRA and they don't enroll into Medicare at 65, they are responsible to be the first payer. No one wants to be in that position. Here's my point. If I am 65, I'm on COBRA, I'm enrolling into Medicare A and B. You're not wasting your money. And then thirdly, what happens? Anyone that's on what we call a small company plan. And what that means is there's 19 employees or fewer on the payroll. Not covered by the group plan, has nothing to do with that. It has to do with the size of the payroll. So if there's 19 or fewer employees on the payroll, then again, you have to enroll into Medicare A and B because that small company plan moves to the second payer position. And just like COBRA, if you don't enroll at 65 into Medicare and you're on a small company plan, you become the first payer. So you enroll into Medicare A and B at 65, Medicare pays first, that company plan is going to pay second. And then lastly, anyone that's on an ACA plan. This would be the healthcare exchange plans, the marketplace plans, the Affordable Care Act plans. Again, what happens with them, technically, you actually can keep an ACA plan at 65. Technically, but practically you're not going to, because all the financial benefits of an ACA plan once you're 65 are going to go away. Which means right now, while you're on an ACA plan before 65, you're probably getting a tax subsidy, some type of a cost sharing by the government. You're certainly not having to pay all your deductible, the max out of pocket. All those things are very favorable for most people on ACA plans. But when you turn 65, all those go away. You'll no longer get tax subsidies. There is no reduced premiums. There's no cost sharing whatsoever. You'll meet the full deductible and the full max out of pocket. So there's no reason at all to keep an ACA plan once you're 65. And here's my whole point. If you're in this one of these four groups of people, you are not wasting your money on Medicare because you had to go on Medicare. Now let's clarify who is, though, wasting money, in my opinion. All right, as we talk about this, I'll kind of support my view as to people who are wasting money. The first one is anyone that is on a large company plan. Now we can see by looking at that, what's a large company plan? That means there's 20 employees on the payroll or more. Okay, and so that's defined by Medicare as a large company plan. Now, as I talk about these plans, keep this in mind. I am saying that if you are on a good large company plan, meaning the premium is less than $200, $250 a month, you have a plan that has a low deductible, has a very reasonable max out of pocket. In other words, the terms of that group plan at work are good. And again, this could be your plan or it could be your spouse's plan. Doesn't matter. If you're covered by an employer-provided plan, 20 employees or more on the payroll, and it's a good plan, good premium, a deductible, a max out of pocket, all that makes sense to you, then you should not at all be on Medicare, okay? And so if you are on Medicare, you are wasting money, okay? So that's one group of people. Now, keep this in mind as well. Let me just kind of side note this. If you are on a large company plan, 20 or more, I still think it's wise to compare that employer plan to a Medicare option, because not all employer plans are good. So if you're paying $250, $300 a month for that and it has a high deductible, max out of pocket's not reasonable, you don't like the plan, then you can go on Medicare at 65. All right, you would not be wasting money in that scenario. But I'm saying here we have a good group plan. Okay, there's a second group of people that, in my opinion, are wasting money, and I'll support this here in just a couple minutes, and that is if you have VA eligibility. It means you served in the military, you qualified for VA benefits. In other words, to go through the VA system. I'll show you how you could be wasting money. Number two, anyone who's eligible for Tricare. Now, Tricare is insurance for people that are retired from the military. VA says they served in the military. Tricare, you're retired. So you served 20, 25, 30 years in the military. Now you have Tricare insurance. Again, you're wasting money unless you're on the right kind of insurance with Tricare. And then thirdly, would be anyone here who's eligible for fehb. This stands for Federal Employee Health Benefits. So you retired civil service. And so there are, again, ways that you also could be wasting money, and I'll show you, of course, how not to here in the video. So the point is, this group of people definitely is very vulnerable for wasting money with Medicare, and we'll show you how to reverse that. Hey, if you found this video helpful and you want to see more Medicare information just like it, then go below, right below the video, and you can give us a thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. Now, in order to understand why I'm saying people waste money and how that can be reversed, we have to focus in on what I'm calling actually 3 Part B enrollment mistakes that can cost you, okay? And so the first big mistake, and probably the most common of these, would be this. These are people who are being auto-enrolled into Medicare A and B, and they go ahead and keep that coverage. So let me explain what I'm talking about. Who is it that's auto-enrolled into Medicare? Well, anyone that is receiving Social Security benefits. Now, those Social Security benefits could be retirement benefits of your own, could be spousal benefits, it actually could be survivor benefits as well. In other words, anyone who's receiving retirement benefits, Social Security through the survivor benefits or a spousal benefits, again, you may be wasting money. Okay, so what happens in this scenario, if you are receiving Social Security benefits, you're going to be automatically enrolled into Medicare A and B. All right, so let me just give you a quick example. I'm shooting this video today. It is 4/16 of 2024. Okay, now let's say someone has a date of birth, 4/16, and they're turning 65 today. Right? So that means they were born 4/16, 1959. And so they turned 65 today, so they're eligible to begin Medicare on our birth month. Now, the exception to this would be if you're born on the first day of the month, let's say April 1, they would have started your Medicare in March. But if you're born on the second day thereafter, it's always your birth month when you're eligible for Medicare. So let's say in this example, someone is eligible for their Medicare A and B, and that is going to be 4/1 of 2024. Okay, now they're receiving Social Security in my example, so what's going to happen? They're going to be automatically enrolled in A and B. So here's what's going to happen. Watch this. Okay, so here's what happened in my example. We're eligible 4/1/2024. We're on Social Security, we're auto-enrolled, and the Medicare card is automatically mailed to you about 100 days prior to your birth month. Okay, and so what I'm saying is sometime between December 15th and December 25th, the Medicare card is going to be arriving in the mail. Okay, so if someone's born in May, that card's going to show up in January. The point is, they always mail that card to you about 100 days in advance. All right, so you're on Social Security, you're going to be automatically enrolled. Now, again, I'm saying here the mistake is keeping the coverage if you or your spouse are still working and you're covered by a very good employer-provided plan, which means what? You have 20 employees on the payroll, and you like the plan. It could be, the premium's attractive, the deductible, the max out-of-pocket's all reasonable. Maybe your spouse is on the plan. Maybe your children up to age 26 are on the plan. But you like that group plan. And so what I'm saying to you, you make a mistake by keeping all of your Medicare benefits, okay? Now, I'm going to suggest you, I'll show you here in just a minute, that we have to keep Part A, because if I'm receiving Social Security, I have to have Medicare A, but I don't have to have B if I have a group plan 20 or more, mine or my spouse's, that I like. We like the cost of coverage and all that, so you do not have to stay enrolled in the Medicare Part B. You have to have A, don't have to have B in this scenario. So let me explain how this works. All right, so here's a copy of the Medicare card. So it shows up, and of course, this says 1/1/2024. My example would have been 04/01/2024, but you get the gist. So if I decide that I'm going to keep the card and I have a group plan that's 20 or more, what happens is this. Medicare A and B are only going to pay second, and your company plan is going to pay first, all right? And so what's bad about that? What's bad about that, Part A for most people is no cost, but that Part B is going to have a premium. So what are you paying for Medicare to be in the second payer position? You're paying at least $174.70 a month. That's the Part B premium for 2024. Now, if you're high income, single, that makes above $103,000, married couple filing a joint return that's above $206,000, you are actually paying more than the $174.70. All right. But Medicare says that if you're still working, your spouse is, then that group plan that's 20 or more always pays first. Medicare is going to take the second payer position. And I'm just saying to you that, in my opinion, is truly a waste of money if you have a good group plan. So here's what I would suggest. Let's take the card and just turn it around. And here's what you're going to see. On the back of the card, you have the option to suspend taking Part B. Again, you're on Social Security, you have to have Part A, but you don't have to have Part B. And so on the card, they give you the option to not take Part B. And so you'll see up here, hopefully you can read this, I do not want medical insurance. Remember, Part A is called hospital. Part B, the outpatient side, is called medical. So you can check the box, you can sign your name, and you can mail the card back into Medicare. And when they get the card, what they're going to do is they're going to amend your benefits. They're going to drop off the Part B. Therefore, you're not going to have to pay for that Part B, and they're going to send you a new card. And that card's going to look just like this. It's going to say Part A hospital only. And then when you lose the good group plan, then you can pick up B at a later date, and you're going to be coming in through what we call the SEP, or your special enrollment period. So we can pick up B at a later date when we lose the good group plan. So all I'm trying to teach you is that if you have a good group plan, send the card back in, drop off the A, and you'll pick up B at a later date. If you keep the B, I think that's a waste of money. All right, that takes us then to the second mistake that people often make, and that's this: self-enrolling into A and B while still working. And so why this happens is because, of course, we can tell by self-enrolling, they're not on Social Security. So this is a person that really fully doesn't understand all the Medicare options. They know they're turning 65, so they just go ahead and they enroll into Medicare A and B. So they get their card issued. All right, but they made that happen. And so when this happens, again, if you have a good group plan, which is what, again, we have 20 employees or more, and you enroll into Medicare A and B, what's happening? I just taught you this. A and B is going to pay what? A and B is going to pay second. That group plan is going to pay first. So people do this simply because they're confused. So if you have made this mistake, self-enrolling to A and B too early, then let me show you what you can do to get that reversed. There's a form that you would need to fill out. We'd be happy to help you with this as well. And this form is actually called the Form 1763. So CMS 1763. Here is really the meat of that form. I just wanted you to be able to see this here on the screen. So I want to draw your attention to the title of this. Now look what it says. Request for termination of Premium Part A and Part B, and then also immunosuppressive drug coverage, which is a plan for people that have had end-stage renal disease, kidney failure, and they had a kidney transplant. A separate program. But my point is, this is a way to terminate. But notice it says Premium Part A. This only affects about 1% of the population. So the only way, once Part A has become effective, the only way that we can ever terminate that is if we're actually paying a premium for it. And there are some people who have to do that. 1% of the Medicare population, people today are paying either $278 a month for Part A or $505 a month, depending upon how many quarters they have. But as long as we have 40 quarters or more, then our Medicare Part A is premium free. And so it doesn't say premium free, does it? No. So that simply means that if you enroll into A, you're not going to be able to terminate that ever unless it's something you did in advance. Okay, so the point is, no big deal for most people. A is free anyways, but in this scenario, if I'm paying a premium for A, that $278 a month or $505 a month, I can terminate that. Okay, but what I'm trying to teach you primarily is that this is also the form that if I want to terminate my Part B. Well, why would I do that? Because I accidentally, in this example, made a mistake. I enrolled into A and B, and that has now gone effective. I realized the mistake I made, and so I want to terminate the B part of it. I would fill out this form 1763. You can see here, you'd put your name in here. You're going to put your Medicare number, that 11-digit Medicare number you have. And then here, it says this is a request for termination. In my example, we're just simply going to put this, terminating Medicare Part B, which is called medical insurance. the date that will end. And so I'm shooting this video. It's 4/17 today, 4/16, excuse me. And so I would put in here, date it will end. I would put 4/30 of 2024. I'm going to tell them the date I want it to end, because I want it to end just as soon as possible. Okay? And then what you're going to have to do, it says here, I request termination, and then they say for the following reason. And what I would do is I would say this: I mistakenly enrolled into Medicare A and B. I'm still covered by an employer plan that's large group, and so I'm terminating because I don't want to waste any more money. Something along those lines. Okay, so the point is we're going to complete this form, 1763, and then you're going to get this form to your local Social Security office. And so you can fax it in or mail it in or even drop it off if the office happens to be close. Now, I will tell you this. Whenever we fax anything to local Social Security office, we always mail a hard copy, letting them know, hey, I faxed on this day, but I'm sending a hard copy to make sure you all received it. Okay, so mail it, fax it, or drop it off. And frankly, I think dropping off is the best. Most offices are open. These are Social Security offices, Monday to Friday between 9 and 4. And so that would be another way you can get it here. But the whole point is you're going to fill this form out. They will drop off the Medicare Part B, therefore we don't have to be paying for it anymore, and they'll send you back a new card. And that card's going to look just like this. Again, it's going to say Part A only, and again, we'll pick up B at a later date. So again, if this is your situation, fill out the 1763 and start saving money. All right, that brings us into the third mistake that people make, and that's this. These are people that were retired, 65 years old, and what they did is they enrolled in A and B, and so what happens then, they find they don't like retirement, or they need additional money, or maybe their spouse, whatever, and they go back to work. And now they have a wonderful group plan. Remember the key: 20 employees or more on the payroll, right? And they like that plan. And so the big mistake is doing this, keeping A and B after you return to work. Now, if the group plan's lousy or it's 19 or fewer employees, then you're going to stay on Medicare. But if you have a good group plan available, you or your spouses, then I would highly suggest that you don't keep both parts of A and B. Okay, so how are we going to reverse this? What are we trying to do? We're trying to get rid of that Medicare Part B coverage. How are we going to do that? Well, what we're going to do, same as before. We're going to fill out a 1763, that form. I'm not going to redo this again, but it's the same identical form. Fill it out. And then the reason over here is going to be what? Is because I returned to work and now I'm covered by a good employer-provided plan. And so again, you're going to mail it in, fax it in, drop it off at the office, the 1763, put the date you want it to end. They'll drop off the B, and again, we're going to save money. You don't have to pay for the Part B premium any longer. And as in the other scenarios, they're going to send you a new card, and it's going to say Medicare Part A only, and again, you'll pick up B when you lose the group plan. Now, I want to close out the video by drawing attention to some people that have some very unique circumstances. And these unique circumstances are for those that have VA benefits, Tricare insurance, retired military, or retired civil service FEHB benefits. Again, these are unique opportunities for them, but if they do not, if this is you, do not take advantage of them, then again, I don't think you're really getting the most out of your Part B premiums, and I'll explain here next. All right, so we're talking about very unique circumstances here, how you can actually reduce your Part B premium if you're in one of these three scenarios. Okay, so let's talk first of all about those that are eligible for VA. Again, you served our country, and you're eligible to go and get your medical care through the VA system. Very, very good system. So I'm going to actually give you kind of 7 action steps that I would take if I were eligible for VA benefits. Number 1, what I would do, I definitely would enroll into Medicare A and B. Now again, this is one system you qualify for because you paid into the Medicare system for at least 10 years worth of work, probably 30 or 40 years, but at least 10 years, so you're eligible for Medicare. This is because you served our country in the military, right? So we have 2 different systems. All right, and so I would suggest highly that you enroll into A and B. If you don't enroll into A and B and you want to pick up B at a later date, just remember that you're penalized for every 12 months that we go out without Medicare B without it, where it's assessed a 10% penalty. All right, so sometimes veterans just use the VA and don't do anything with Medicare, and that can be a real serious mistake, especially if the VA system were to change where you want to go outside the VA system. So I highly suggest enrolling into A and B. Sure, you're going to have to pay your premium for that Part B, but you get a lot of coverage for that little amount of money. Okay, so that's step number 1 if it were me. Step number 2 would be, then what I would do is I would enroll into a Medicare Advantage. These are also called C plans plans, also called replacement plans, right? I would enroll in one of those. I have VA, I roll into this private health insurance company, but notice what I'm saying. I'm saying MA only. MA only, which means through my Advantage plan, I can get services, civilian services, on an inpatient or outpatient basis. Just with that Medicare Advantage plan, you can go to the hospital. You can see doctors. You can have a surgeon operate when you're in the hospital outside of the VA system. We call that an MA-only plan. And what I'm trying to teach you is an MA-only plan does not include prescription drugs. Why? Because you can get your prescription drugs through the VA system. And so when we enroll into an MA-only plan, it's going to give us that civilian option for in and outpatient services. So you have lots of options then. Number 3, then what you need to do whenever you need a healthcare service, notice you can use whichever system you want to. So if you feel like it's best to go to the VA for a certain issue, or you want to go to a local hospital and have a local surgeon or something operate on you, you can do so. You have the liberty to use whichever one of those that you want. So that's the beauty of this particular kind of a program. Use whichever. Number 4, then what you're going to do though, notice you're going to get your prescription meds through the VA. And there's a reason, I'm going to show you why. But again, usually it's because the VA meds are going to be less expensive. And so we highly suggest, because we did an MA-only plan, the prescription drug part we're going to get through the VA, and it's considered to be credible coverage. You will not be penalized down the road if you decide to get a traditional Part D plan, all right, because the VA, again, is going to be credible. Number 5 step. Now, here's one which you realize what's going to happen when you do this MA-only plan, because you're getting your meds to the VA, then that Advantage company was going to take some of the money they receive from the federal government, and they're going to give you a reduction in your Part B. So the Advantage plan will give you a credit, and sometimes that's $50 a month. I've seen it sometimes as high as $100 a month. So what happens? Well, that Part B premium that's $174.70 has now all of a sudden been reduced by $50 to $100. So I'm saying if you don't enroll in one of these plans, again, I think it's a waste of your money. So enroll in one, get that Part B reduction. Number 6, now what you also have is you have all these perks outside of the VA system that are now available to you. Dental, vision, hearing aids, over-the-counter cards. There's a variety of perks that you can take advantage of now. So use the VA when you want. Use your Advantage plan when you want as well, because of all those perks. Gym memberships, those kinds of things. And then here's the beauty of this scenario is this. This decision can be reevaluated every year. So if you just say, hey, I don't want to do that MA-only plan, no problem. You can drop it during Medicare open enrollment season, and you can go back to just simply having your A and B with VA, all right? So you're not bound to this forever. And so I really like the flexibility that this gives you when you enroll into the MA-only plans. All right, so that was the scenario for those of you that have VA benefits. Now I want to talk about those of you that are eligible for Tricare. Again, retired military. All right, and it's going to be very similar, but I just want to note a couple things that could be a little bit different. So first thing, again, you have to enroll in A and B. Even if you don't do anything beyond Tricare, you have to enroll in A and B, because Tricare goes to the second payer position. All right, and so again, you're going to have to pay that $174.70 a month regardless. And so what you can do in addition to that is this. You can again enroll into, notice, an MA-only plan, just like VA. Why? Well, because we can get our meds through Tricare insurance. And so when we enroll into the MA-only plan, notice we're suggesting to get a PPO plan. So you've got a very, very broad network. You've got a network if you need to, no problem whatsoever. But here's the beauty of this. Your Tricare insurance will coordinate benefits with the Advantage plan. And so if you were to go to the doctor, or you ever had to go to the hospital, you would give them your Advantage plan card as well as your Tricare card. And so you should really probably be out of pocket almost zero. Usually it's zero because the Advantage plan may have a copay, but that Tricare insurance will cover that for you in most situations. So again, you should be very little out of pocket, because Tricare is willing to coordinate with A and B. They're also willing to coordinate with the Advantage plan. All right, and so it's a very, very good option. And notice also what's going to happen. Just like the VA, we're going to get our prescription medications through Tricare insurance. So if I go to Walgreens or CVS or Walmart or wherever you go to get your meds, what's going to happen is you're going to use your Tricare insurance for that. Okay, why? Because we have an MA-only plan, which is for inpatient and outpatient. So meds, again, through Tricare. Fifthly, excuse me, now what's going to happen again, that Advantage plan, just like we looked at earlier with the VA, we have an MA only plan, they're going to give you a Part B reduction. And again, folks, I'm telling you, that sometimes is $50 to $100 every month. That's going to come right off of that Part B. So we get a reduced Part B when we enroll in the MA only plan. And then number 6, again, take advantage of all the perks, gym membership, the dental, the vision, the hearing aids, over-the-counter cards, all those kind of things that come with the Advantage plan. Now you can take advantage of those because that's not part of your Tricare insurance. That's something that the health insurance company is going to provide for you. And then, of course, number 7, the beauty is you're not bound to this forever. So if you decide, I don't like that MA only plan, I'm going to get out of that, no problem. You can do it any year during the open enrollment season as well as the annual election period for Medicare. You can drop the plan and just go back and have A and B with your Tricare insurance. So again, I think if you don't do this, this could be a tremendous waste of your money. Hey, Medicare can be very confusing. In fact, people make mistakes all the time because of how confusing it is. So what I've done is I've actually created a Medicare, notice this, Essentials Workshop, where you have the opportunity to really learn everything that you need to know about Medicare so that you can make Medicare decisions. There are thousands of people every month that watch this workshop, and we get lots of reviews saying that this is something that really was helpful to them. And so what you can do is down here below in the comments section, you'll see where it says pinned comment. At the very top of those pinned comments is a link. And you click on that link, what we're going to do is we're going to give you free access to this Medicare Essentials Workshop. And we want you to watch it because we don't want you to make any mistakes. All right, that brings us to the last scenario, and that would be people who have what? FEHB benefits, retired civil service, retired from the FBI or the Treasury Department or Homeland Security or IRS, whatever. You retired from the government and now you have federal employee health benefits. Now you actually have 2 options, okay? I'll explain these and I'll close out the video. But option number 1, I'm not saying it's the best of the options, I'm saying this is one of 2 options. What you can do is this, you can enroll into Medicare A and B. Now I am fully aware that if you have FEHB, you don't even have to take Medicare B if that's all you're going to use is FEHB. I don't like that option. I'm going to tell you why. Because you only have coverage on the hospital side, and FEHB then pays second to A, but they'll pay first on the B side, but you have to be the second payer. So that means you're going to be out of pocket. Co-insurance, sometimes deductibles, max out of pocket. So I really think if all I was going to do with FEHB, I definitely would enroll in a Medicare A and B. If you don't get the B and you pick it up at a later date, you're going to be subject to penalties. 10% for every year that we went without Medicare B. So I suggest, again, enrolling in A and B. Then secondly, once I've done that, now I can enroll like the VA, just like Tricare, I can enroll again into that MA only PPO plan. All right, so what's going to happen? Notice what I have. FEHB will coordinate benefits with the Advantage plan. FEHB will coordinate with A and B, but if you enroll in an Advantage plan, they will coordinate with them. And again, you should be probably little to nothing out of pocket. Your Advantage plan pays first, FEHB is going to pay second, and they're happy to do that. And then number 4, then you're going to get your meds, what? Through FEHB because I enrolled in a Medicare Advantage only, inpatient, outpatient. So my meds, I just pull out my FEHB card when I go to the pharmacy to get my prescriptions because you have prescription insurance built within the FEHB plan. Number 5, now the Advantage plan again is going to give you a Part B reduction, just like the vets, just like Tricare. That Part B reduction is going to come down about $50 to about $100 a month. Now the beauty about this is also for those of you at FEHB, if you have your FEHB through GEHA or through FedBlue, they also think they give you about $800 a year credit as well. So we're really pulling down that $174.70 a month through the FEHB system as well as through the Advantage system. And then again, like the others, now we have all these perks, gym membership, dental, vision, hearing aids, all those kind of things that you can take advantage of that were not a part of your FEHB program. And then again, the beauty is decision can be reevaluated every single year. You are not bound to staying within that system. You can drop the MA only plan and just use A and B with your FEHB benefits. Okay, so that is option number 1. A lot of FEHB recipients are doing that. And then we have option number 2, which is also very popular. Let me explain that one. Okay, so here's option number 2, right? FEHB recipients. So what you can do is this. Again, we're going to enroll to Medicare A and B, which means what? We're going to have to pay that $174.70 a month for our Part B premium. But instead of the other option where we actually kept our FEHB, here's what I'm suggesting some will do. I think it's a good option, and that is to do this. We suspend FEHB plan. Okay? Now, I'm not terminating it, I'm just suspending it. But the beauty of doing that, folks, not only when you suspend it, that plan, they're also going to suspend the premiums. Now, your premiums right now for most people are usually about $400 to $600 a month for a couple. $400 to $600. You can actually suspend that premium. All right? Now, a lot of people are not aware of this is because these premiums are actually coming out of your government annuity. All right? You're actually paying for those. All right? And so if we go ahead and suspend those benefits, then you no longer have to pay for those high premiums. All right, so this is the form that we use to suspend those benefits. And it's actually called an RI 79-9. All right, so this, and I know you probably can't see this, but it's an OPM form. And this is the form that has to be filled out in order for us to suspend our FEH benefits. And again, you would put in your claim number here, your CS number, the date of course, and what your name and your mailing address is. All right, so this is the form. I'm going to show you exactly what box you would need to check to do what I am suggesting. And this box would be actually box number C, because there's a couple different options here. But again, if we're going to just enroll into a Medicare Advantage plan that I'm suggesting, then we don't have to terminate FHB, we just simply suspend those benefits. So this is option number C, so you would check the box C, and here's what it says. I am suspending my Federal Employee Health Benefit Program, FEHB, and because I am enrolled in a Medicare Advantage health plan, okay? Medicare Advantage health plan. And so again, if this is something you would like to do, what's happening? Well, when I disenroll from FEHB, OPM is going to stop taking my monthly premiums out of my annuity. All right? And so you still have wonderful coverage. It's just going to be different. All right, so you would mail this in to OPM, and again, they're going to drop off the FHB program. All right, so then what's going to happen once that's done? Now we're going to enroll into an MAPD PPO plan. So we still have a great network here, but notice everything I've talked about thus far was MA only, meaning we were going to get our meds through the VA, Tricare, FEHB system, and this one, not so. What we're going to do now is we have the Medicare Advantage that covers us for what? Our in and outpatient, but now we're going to get a prescription drug plan, which is called Part D, added to that. All right, that's what I mean by MAPD. It's going to be everything, one card issued, and everything is going to be taken care of through the Advantage company. And so again, we're going to use our MAPD card for all medical needs, and we're going to use it for all prescription meds. All right, and so now we don't have FHB. It's just sitting out there waiting for us if we want to return. But we suspended that. All right, and we saved the money. Number 6. Now we can take advantage of all the perks that are offered. Again, gym membership, dental, vision, hearing allowance, all those kinds of things. And then also, what's going to happen? This decision is going to be reevaluated every year. And so if you decide you don't like this, then what happens? There's actually 2 times a year you can return. You can make the decision to get off the Advantage plan October 15th through December 7th, okay? And then you'll just have A and B and FEHB effective January 1, or what happens, you can make the same decision January 1 all the way to March 31. All right, and you don't have to qualify. You just simply drop the Medicare Advantage plan, and then you let OPM know I'm coming back into FEHB program, and you can do that during these months of the year. So if I make that decision to drop the Medicare Advantage plan in January, that'll go effective February. If I do it in February, that'll go effective March. If it's March, it'll go effective in April. Okay, so all I'm trying to teach you is that you're not bound to that decision. So we have a lot of people who want to try it. In fact, 99% of all people that try this particular option normally stay with that plan, knowing in their back pocket they can always go back to FEHB if they need to. All right, and so these are the ways in which I think people can save money, and we just simply don't want people to throw their money away. And so if there's anything that we can do to help you to make sure you understand this system, that you follow the guidelines and all the paperwork is done properly, we'd be happy to assist.